It's now time for our weekly partnership with Asante. And this week, Asante's health expert Beth talks with Dr. Ben Salgado about living with a chronic condition like heart failure.
The term heart failure makes it sound like the heart is no longer working at all and there's nothing that can be done, kind of like a death sentence. Dr. Salgado, what is heart failure and what causes it?
So heart failure is a condition in which the heart is unable to pump the adequate amount of blood to supply the different organs, or if it does it at elevated pressures. There's different reasons of what can cause heart failure. The most common cause is what we call ischemic cardiomyopathy. So these are patients that have had a heart attack. But other causes are also important, like long-standing hypertension can cause heart failure.
And what are some of the signs and symptoms that people will experience?
The most common signs and symptoms of heart failure include swelling of the legs, usually it's both legs, shortness of breath, difficulty sleeping in the sense that people have to prop up their pillows to catch their breath, or just frankly, just waking up in the middle of the night with shortness of breath. Usually, this doesn't get better just by just breathing in and out. It usually takes like 30 minutes with some, usually patients will describe opening the window to catch their breath. So those are the most common symptoms. There are other symptoms like associated symptoms that can include chest pain or uncontrolled hypertension or other symptoms that can cause it.
So how do you teach patients to live with and manage their heart failure?
So here it's really I want to emphasize our heart failure clinic. We have a great we call it a heart care clinic because we want to win the battle of the heart failure. And usually it's very difficult to manage heart failure, but people can learn to weigh themselves every day, calculate the amount of fluid that they drink. We ask them to be very careful with their salt intake. We give specific medications also to help, and definitely physical activity is something that can also help patients feel better and learn how to live with heart failure.
So it sounds like although it can be difficult living with this chronic condition, many people learn to manage the symptoms and enjoy full lives. Thank you so much for your time.
No problem. Thank you.